Welcome back to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. You may have heard the phrase before, probably from a provider or maybe just whispered at a nurse's station. She's just in false labor. It's just false labor. Oh, she's not in labor yet. Maybe you were sent home from the hospital. Maybe you were told to come back when things get serious. Maybe you started to doubt your own instincts or even your own body. But the truth is, there's nothing false about what your body is doing. Pre-labor is not a mistake. It's not a failure. It's not a tease. It's a phase of hormonal, emotional, and structural preparation, and it's one of the most under-recognized and misunderstood parts of the birthing process. We will be shining a light on what often gets dismissed, which is prodromal labor that starts and stops but serves a real purpose, the ripening of the cervix long before it begins to dilate, the emotional shifts that soften your system as you approach labor, and the quiet work of the nervous system, the uterus, and the baby prepping for the way of birth. This was not wasted time. This is not false. This is not fake. This is a transformation in the process. In your body, it knows exactly what it's doing. So let's dive into it. What is pre-labor? Let's name what the phase really is. What we call it really matters, and what we call it really shapes how we experience what we're feeling and processing in the moment. That stretch of time where something is clearly shifting in your body, but it's not quite go time yet. It's often brushed off as false labor, but that label is very misleading. And honestly, it's a little disrespectful, in my opinion. There's nothing false about what's happening. This is pre-labor, and for many women, it unfolds extremely slowly over hours, days, even weeks, laying the physiological and emotional groundwork for birth. Pre-labor is not early labor, and let's get that really clear. Pre-labor is the body's preparatory phase. Contractions may be irregular, mild, and not causing any cervical dilation yet, but meaningful change is underway. Early labor is the cervix beginning to dilate and efface. Contractions become more coordinated, and labor, the labor label, starts to feel a little bit more accurate. What makes pre-labor tricky is it often feels like the real thing and then it stops, or it never fully intensifies. That doesn't mean that your body's broken or behind. It means that your body is working in alignment with its natural timing. So what's actually happening during pre-labor, even if you're not dilating, your body is warming up the uterus with toning contractions, often called Braxton Hicks. It's repositioning the baby into a more optimal fetal position for birth, softening and ripening the cervix. We'll get more into that. Balancing in hormonal rhythms like oxytocin, melatonin, prostaglandins, calibrating the nervous system for the intensity of labor, and then prepping your mind and emotions to cross the threshold of birth. Common signs that you might be in pre-labor include a feeling that baby has dropped, pelvic pressure, cramps, aching of the back or in the groin. If you feel like doing this motion, oftentimes that's aching in the groin. Increased discharge or losing your mucus plug, not always easy to notice. Frequent bowel movements, restlessness or emotional waves, and then sudden bursts of energy or nesting. And you might be feeling like you're bouncing in between, this is it, and never mind, this is not it. That's okay. That is normal. But let's reframe it. You are not in limbo. You are not broken. You are not stalled. You are transitioning. You are softening. You are preparing. Just because you're not in the birthing tub or en route to the hospital, birth center, birthing place doesn't mean that nothing is happening. Pre-labor is foundational, and the work beneath the surface, hormonal, muscular, emotional, that all makes way for birth to unfold. And there is purpose behind prodromal labor. It starts, then it stops, and you might hear it called false labor, start and stop labor, practice labor, or most commonly, what I just called it, prodromal labor. Prodromal labor is the phase where contractions begin to look and feel real, sometimes even rhythmic and intense, but doesn't result in a progressive cervical dilation. Unlike Braxton Hicks, which can be mild and somewhat random, prodromal contractions can be strong enough to wake you up at night. They can last for several hours at a time. They can follow a pattern every 5 to 10 minutes apart. Then they can fizzle out without quote unquote leading to anything, except they are leading to something, birth. So what's the point of it if the cervix isn't dilating? Again, I'm going to keep saying it over and over in this episode. Prodromal labor is doing critical work. Even if you can't measure it in centimeters, it's doing so much work. With that toning and aligning the uterus muscles, this can be more efficient for contractions later. Prodromal laboring, helping the baby shift into an ideal position, especially if your baby is slightly off center or posterior, OP, if you hear OP. Prodromal labor also warming up the oxytocin receptors, laying foundation for labor to snowball later. If the oxytocin receptors are nice and open, ready to receive oxytocin, we're good to go. As soon as that oxytocin starts pouring, we can receive it, accept it, start saturating the body with those nice, relaxing hormones and get the cervix ready to soften and actually dilate. Prodromal labor also is priming your nervous system, toggling between fight and flight or rest and digest, preparing you to enter that labor zone, which ideally is going back and forth between both of them, but not having dominance in either, especially not fight or flight. This is your body's way of practicing with purpose, like a dress rehearsal for a wedding. This is not about perfection. This is about refinement and really attuning to what's about to come. And you might be asking, why does this happen multiple nights in a row? Nighttime contractions, that's by design. Most prodromal laboring shows up or tends to be at night or while you're sleeping or right before you go to sleep, and that's not random. Because melatonin, your natural sleep hormone or wind down to rest hormone, increases in the evening and it amplifies oxytocin, your labor hormone. Your parasympathetic nervous system is more active at night as well. It's your rest and digest mode, the ideal state for labor to start unfolding. Culturally and evolutionarily, night was a safer time to birth with fewer predators, less attention. It feels just more normal and safer for the body to actually get into a safe rhythm. So naturally, what is your body looking for labor? Safety, comfort, softness, all the things. That's what nighttime gives us. So if your labor keeps starting overnight and disappearing by the morning, it's not a failure. It's actually aligning with your body's natural rhythm, and that's really, really awesome. It can really help when your body is ready for full labor to actually go into labor during that safe, more safe time when your body's naturally going to feel more safe, naturally feel more rested, digested, and in that receptive state. So again, a little bit more reframing. Prodromal labor isn't not working. It's working beneath the surface. It's not a failed start. It's a foundational warm-up. When we stop dismissing this phase as false, we can really start recognizing it as purposeful, meaningful, and intentional for a successful labor and birth scenario here in just a couple days. Ideally, a couple days. Sometimes it is a week or two later. Sometimes it's a couple hours later. But having this mindset can really help open the door for possibility for labor to happen at any time. It can really start to wash away that worry, stress about going into labor. Can my body go into labor naturally? Do I need to get an induction? All these stressors that are only going to keep us further and further away from labor. Accepting and knowing this knowledge really does help your body relax and accept labor, prodromal labor, as is. And cervical ripening isn't just about dilation. We hear the 10 centimeter mindset everywhere. Are you 10 centimeters yet? Well, when we get closer to 10 centimeters, we're on transition. We're about to be at 10 centimeters, 10 centimeters all the time. 10 centimeters is not perfect for everybody. Not everybody has a perfect 10 centimeter dilation. And a lot of times it doesn't even come first. Dilation isn't the first thing to happen for the body to prep for labor. It's usually one of the last things that happens. Before you ever get to 1 centimeter, the cervix has to soften and become less firm. It's like going from the tip of your nose down to the top of your lip. That thickness to that softness, that's what we're looking for. It has to efface, which means it has to thin out and shorten. If you think about a turtleneck stretching it out, it's going to get thinner and stretched out, right? We're going to create dilation, but it's actually going to get thinner on the tissue at the very top. And then it also has to move forward. The cervix starts posterior and it swings anterior towards the vaginal canal. These changes are collectively known as cervical ripening, and they can take days or weeks before labor even begins, which leads us into what makes the cervix actually ripen and do all of this. This phase is beautifully done through hormones, and it's also mechanical. It's your body and your baby working together to prepare for the passageway. The main players include all of which we have talked about many, many times. So a lot of this should just be a refresher. We have prostaglandins, which help soften the cervix and activate enzymes to break down collagen. We have relaxin, which loosens the ligaments and cervical tissue to make the pelvis and cervix more mobile. We have oxytocin, which contributes to the uterine contractions that gently massage the cervix toward readiness. And then estrogen upregulates oxytocin receptors to make sure the uterus is more sensitive. Those are our hormonal players. My mechanical player is fetal engagement. It's our baby. So as baby descends, their head taps rhythmically at the very top of the cervix, the inside portion of the cervix. And it stimulates the local prostaglandin release and encourages the softening from the inside out. This repetitive pressure, especially done when baby's well positioned, is like a knock at the door that we're ready to move on to the next phase. So here's why we can't rely on dilation alone. Some people walk around 3 to 4 centimeters dilated for weeks before labor begins. I've had many patients and clients who have been dilated for weeks prior to actually going into active early labor. Others go from 1 to 10 in just a few intense hours. I've also experienced this frequently. A lot of our moms where their bodies are really primed to go into labor and birth, they do go into labor quickly and they progress even quicker. Some labor patterns, especially in subsequent births, are just not as linear or as predictable as we might think. It's not a numbers game, it's a readiness game. And cervical ripening is part of that slow, purposeful prep that often gets overlooked. So now to reframe this, dilation is loud, ripening is quiet, but quiet doesn't mean unimportant. So much of the birth process begins in whispers, in softening, in shifting, in surrender, and the cervix is no different. So let's always keep that in mind, that even if it doesn't seem like something's happening and it feels like something's happening, but it doesn't seem like something's happening, stuff is happening. You are validated in that. It's okay if if there's nothing to show for the progress or the progression. It's the same with pregnancy, early in pregnancy, when moms don't have a bump and they're like, I feel like I have nothing to show for all of this lack of energy, fatigue, morning sickness, all this stuff. It's okay. It doesn't mean that something incredible isn't underway, taking place underneath the surface. While I know it's much easier said than done, the emotional and spiritual work of waiting is tough. It really is tough. And, I see moms weekly. So when moms come in at 38 or 39 weeks, they're like, I hope we go into labor next week. And then they don't go into labor next week. And they're back in the office. They're like, oh, I'm so disappointed I didn't go into labor. And then I see them again the next week. They're like, things started, but then nothing happened. And I can see the frustration that starts to accumulate. This is one of the most emotionally taxing parts of the prenatal journey. The start and stop of labor, the prodromal labor, the thinking it's going to happen. You've been anticipating this experience for 10 months, and now it might be here, but you're not sure if it's here, but it is here, but then it stops, and then whatever. It's a lot. It's really emotionally taxing. And when your guest date has passed, or you've nested 3 times, or you're starting to have signs, but then labor hasn't actually begun, it can really feel like your body is stalling. It can feel like you're missing something. It can feel like you need to do more to make it happen. But what if that stretch of time, that waiting, wasn't about doing anything? What if it was more about softening, surrendering, and opening? I know that's so much easier said than done. But I encourage you and I invite you to welcome prodromal labor, to really prep your body for a successful labor and birth. Every time you have prodromal labor or a contraction, your body and your baby gets to learn from it. So all of these frustrating nights or intense nights and then nothing happens, these are ways for your body to get more educated and prepare for birth, especially for my first-time moms. If you experience prodromal laboring and you're getting frustrated by it, try to reframe that frustration with, my body is practicing something that it hasn't ever done. It needs to get more familiar with contracting and getting ready to push a baby out because it hasn't done it yet. Okay, you guys, I'm super excited about this new sponsor because it's somebody I've actually been working with for a while now called The Final Punctuation. It's a female-owned, one-woman editing and proofreading service. Her name is Carrie, and she has completely changed how confident I feel putting my words into the world. She's helped me with everything from my brochures to my doula contracts to small marketing things. And not only is her turnaround time incredible, but she helps you to understand the why behind her edits. She sees things that I would have never caught and somehow keeps your voice intact while making everything stronger, cleaner, and clearer. She works with all kinds of creators, from bloggers, podcasters, to small business owners, marketing folks, and even students. Anyone putting their words out into the world. And if you've ever posted something and noticed a typo after, you know how it feels. One tiny error can totally kill that first impression. In fact, stats show that only one typo can increase bounce rates by up to 85%, and grammar mistakes turn away nearly 60% of readers. And I know what you're thinking about AI. Can it just take care of all my grammar mechanics? AI still struggles with tone, nuance, and accuracy, which is not a great combo if you're trying to earn trust. So if you're writing anything from podcasts to brochures, website copy, marketing materials, let Carrie take a look at it. Visit thefinalpunctuation.com to submit a request for any project and tell her that you're a Pop Podcast listener for 15% off your first order. That's thefinalpunctuation.com. Now let's get back to the episode. There's this powerful idea in birth work called the emotional cervix. It's the belief that the emotional readiness can influence physical readiness. I want to say that again. It's the belief that emotional readiness can influence physical readiness. And while this might sound woo-woo to some people, I totally get it if it does. It really does track with what we know about the nervous system and hormonal regulation. So stress hormones like cortisol and adrenaline can slow or stall cervical change. Feelings of fear, pressure, performance can tighten up the pelvic floor or cervix. And on the flip side, oxytocin, the hormone that opens the cervix, is only released in safety, privacy, and love. So the cervix doesn't open on command. It opens when the body feels safe. And sometimes that safety requires inner work. So if you feel like something is keeping from your body feeling physically ready, a lot of times it can do with your emotions and your beliefs around birth and labor. I just watched this really cool birth story from a really sweet influencer. I've always loved her content just because it's different and it's not typically what I'm doing. So it's different than me. It's someone else across the world or across the nation that I get to engage in their content. And she was sharing her birth story and talking about how she has only ever grown up so scared of labor and birth. While she was pregnant, she would go to sleep at night. She would cry herself to sleep at night because she was so scared of actually birthing a baby out. There was nothing exciting. And she said that in her video. She said, I was raised fearing labor and birth. If that is you, this is where we need to start to rewrite the script. Even if you're like, I want a natural birth, but I'm also so scared of what it might feel like. That fear and that scaredness is what often keeps moms from a natural birth. So starting to rewire that, and that looks different for everybody, whether it's talk therapy, watching different birth stories, working with a chiropractor, working with a craniosacral therapist, working with a pelvic floor therapist, whatever it is, there's a lot of different people who need to be reminded of the safety in the natural event that birth is. We are not taught that here in the United States. It's not often viewed as a natural, super organic experience. It's often looked at as a medical condition and a condition or an experience that someone's going to need help with. They're always going to need our help. They're going to need our guidance. Your body was already designed to do this process. It often doesn't need the guidance of others. But because we always look to medical professionals, we always look to media, and media shows us crazy visions of birth. So starting to explore different areas or different videos or different content that shows you a different story that birth is natural, birth is normal. It's a normal experience. It's not unnatural for your body to push a baby out. It was designed to do this. It can really help start to change your body's ability to go through the physical process and allow the physical process to actually unfold. We also have the work that's happening beneath the surface. That's the hormones that are shifting behind the scenes to get you ready. We have talked about these so many times. So if you don't know about these, go watch the old episodes. This is just going to be a refresher. Again, we've got oxytocin rising slowly and quietly, like water behind a dam. We've got melatonin syncing up with your circadian rhythm to support contractions. We have estrogen increasing your body's sensitivity to labor cues. And the prolactin, the love and milk hormone, that's beginning the role in mothering. Your nervous system is learning how to downshift from alertness of pregnancy to the surrender of labor. It's a massive shift. It really does take all of you to make that shift, and all of you is run by what's happening up in this brain. So the more positive, more affirmation, the more validation that we can find in our body's ability to do the natural birth work, the more access your body's going to have to doing the natural birth work. So again, we have some reframing. The waiting is not wasted. It's not a delay, it's a descent, not a standstill. It's a softening. And this is where your body prepares and your mind lets go so that your spirit gets ready to cross the threshold. So we're going to start closing out this episode by going through some different ways to support the slow burn of prodromal labor. What you can be doing during that pre-labor to make the time feel a bit more effective. If you're in this in-between space of things are happening but not quite happening, you don't need to sit and suffer, and you also don't need to push the river, make everything happen at once. Realistically, that probably won't work. But here's what you can do. You can keep moving gently. Daily walks, birth ball circles, cat-cow, the mile circuit can encourage baby into an optimal position. If your baby's already in an optimal position, here's the thing. I see a lot of patients. I see them weekly. And some patients I see multiple times a week at the end of their labor if they're trying to get baby into an ideal position. Be thoughtful of the positions you're doing, because if you get your baby into an ideal position and then you start doing a bunch of spinning baby moves or moves where your baby is going to be taken out of your pelvis, you're taking them out of the descent that they've already started. It can start to slow down that prodromal labor work that your body's already started to do. So when baby's in the most ideal position, LOA, left occiput anterior, I don't have my baby today, so I can't show you, but it does mean that the back side of their head is here, back is here, bum comes over here, and then arms and legs are coming out this way. Front of the pelvis, back of the pelvis. So if it was me, baby's head would be on this side of my body. That position is ideal. We don't want to get baby out of that position. We actually want baby to continue descending in that position. So I will tell moms to do a lot of hip openers at the very top of their hips. We want baby to keep falling in towards the pelvic inlet. We want them to fall towards that birth canal. So we want to do big deep squats. We want to do those Captain Morgan lunges. We want to do things where baby's getting deeper into the pelvis. Birth ball circles are great. Walking is great. Pressure going down into the cervix is great. Some of those inversions, we want to save those for our actually breech babies or our malpositioned babies. When we have babies in OP and we were trying to get them just to turn one more time to the side, that's when we start adding in some of those inversions or side lying work. So be thoughtful of the positions that you do. Balance your nervous system. Restorative yoga, breath work, vagus nerve stimulation, and obviously chiropractic care. All of these can help tone your parasympathetic nervous system. And again, our parasympathetic nervous system is going to be our gateway into the oxytocin, prolactin, relaxin, all of the relaxing hormones. But also, again, your body is not going to be just parasympathetic. It's always going to have that balance in between sympathetic fight and flight or parasympathetic rest and digest. Then we have eat and hydrate like you're training. You are about to do an Olympic event. Who knows how long your labor is going to be? It could be 4 hours. It could be 6 hours. It could be 36 hours. I just had a mama come back this week and tell me all about her 36-hour labor. She crushed it. She had a super healthy baby. But anyways, you don't know how long this process is going to be and how much energy your body is going to need. You also probably don't have a ton of space in your tummy to eat more food. So it's okay if you're eating all day, small snacks, small bites of food all day, just to keep up with the caloric intake. But it's also okay if you feel full and you need to take a break. Keep trying to put really good nutrients into your body so that you can manage whatever labor you end up experiencing. Live like labor might start tonight. That doesn't mean be hyper vigilant. That doesn't mean have all your bags packed and everything's ready to go and the dogs are already at the daycare. You don't know when you're going to go into labor, but you might go into labor that night. So always plan for it. This means trusting your rhythms. Nap if you're tired. Shower if you feel like you need a shower. Light a candle if you feel like you need a candle. Set the tone for oxytocin to rise when it's time. Protect your sensory environment. Bright lights, noise, and overstimulation can put the nervous system on alert, especially at night. Dim lights, put the screens away, and invite the quiet. You could read. Try not to do any blue light screens prior to bed, especially once you've hit full term. It can really help your body to recognize melatonin, start softening, get into that rest and digest, get into that parasympathetic mode. Blue light screens often keep our brains in a sympathetic dominant state, and it can be really difficult for your body to experience the parasympathetic when it's in a sympathetic dominant state, which can lead to more difficulty going into labor or just lack of ability to get into a natural labor. So when we can take that out and we can be in a stress-free environment, really allows our body to have those natural cycles, natural rhythms to get us into pre-labor, early labor, active labor, all the things. And a reminder for what you don't need to do, if you haven't already accumulated these notes from my other episodes, you do not need to try a new labor starter every day. Castor oil, curb walking, spicy food, pineapple, acupressure, these can all have a time and place, but they're not magic switches. The goal is support, not intervention. So if you think that any one of these are going to be the one thing that makes your water break or makes your contraction start, makes labor happen, you're holding a lot of pressure on something that is probably not going to help or cause labor to start or happen. These are the things. So let me rewind. They do help. These things support labor starting. So when we're doing these things, maybe not the castor oil and maybe not the curb walking, but when we do these things pretty regularly at full term times, they can really help us get into that labor state, but they're not always going to be the labor starters. So don't stress yourself out on trying a bunch of new things all the time, because realistically, no one thing is going to probably start your labor other than your baby signaling your body, hey, it's time for me to go into labor. Moving on, you don't need to monitor your contractions obsessively. This actually can start to slow down the progressiveness of your contractions when you're so stressed out about timing the contractions perfectly. If you're kind of doing it, it can kind of give us a timeline of when your contractions started, when they've increased, when they've slowed down. But when you start obsessing over contraction timing, it really does start to pull away from your body's ability to just stay within its natural timing. It's kind of like when you start to focus on your breathing and then all of a sudden you can't tell if that breath is your natural breath or if it's slower or faster because you're now thinking about your breathing. It's the same with contractions. As soon as we really start over obsessing about the timing of start and space in between, it really does start to pull away from your ability to be in its natural rhythm. Next we have, you do not need to check your cervix. Realistically, you probably cannot effectively check your cervix. Maybe some labor and delivery nurses might be able to, or OBs, birth workers might be able to check their cervix and be like, oh, I'm this many centimeters dilated. You really don't need to do that. It could be introducing new bacteria into your birth canal. It also won't predict your timeline or give you any definite defining measure of where you are in the process. So it's typically not very helpful in general. And then you also don't need to explain yourself to others. You might hear people, especially in those last 4 to 6, even 8 weeks, people being like, no baby yet? When are you due? How far along are you? And you don't have to answer that question. Your timeline is not up for public consumption. when people start asking questions, it's okay to decline and say, we're not telling anybody the due date. Baby's right on time. We're right on time. We're doing just fine. Or no, thank you. You don't have to answer questions like that. And when you start answering those questions or they keep getting asked multiple times, it can be really frustrating. So you can reclaim some of that power by just not sharing that information, keeping that safe to home and with your partner. Now, even though we've just gone through this whole episode of pre-labor is awesome, prodromal labor is awesome, like let's recognize it, let's support it, even though it's normal and it should happen, there are times where you should pause and reach out to a provider during pre-labor. And here are some of the reasons you should start to reach out to a provider. If you experience bleeding, that's more than spotting. Bleeding that's more than spotting. If you feel reduced fetal movement. And this can come from so many different ways. It can be kicks if you're just experiencing not as much movement. You might experience this for a couple hours. You might have noticed it over a couple of days. Reach out to your provider. If your water breaks and it's green, brown, or seriously foul smelling, that just tells us that baby's probably in distress and that there could be meconium present. We don't know how long meconium could have been present. It could have just happened, but it is something to call a provider about. And then also when you have contractions that you can't walk or talk through that last more than an hour. On top of all of this, if you're just feeling that something is off, your intuition, take a lot of weight in your intuition. Like, put a lot of weight into your intuition, take action on it, do something about it, because intuition is not false information. It usually has some truth behind it. So take action. If you feel like anything is off, say something about it, name it, tell somebody. And my biggest tip for everybody, and most often my doula clients, even my patients at the practice, is the tub hydration test. I learned this test from my incredible doula mentor, Miss Haley McNabb. The tub hydration test is a great way to tell if you are in prodromal labor or early labor. So here's what you do. If contractions start, usually they happen at night. So I know that this might be happening in bed. It's worth drawing a bath and seeing if this is actually labor, if you think that it could be. Contractions start. You get in the tub. Get in the tub and notice you can start timing your contractions. If contractions pick up in speed or intensity, you're in labor. It's go time. If they start to slow down or be less intense, you're having prodromal labor. The tub hydration test is such a great way to identify and immediately rectify in your body. We are either doing this or this is just pre-labor and my body is just prepping for labor. And I hope that was helpful. If this episode was at all insightful for you, please share with another mama to be, your doula, anybody that you want to share it with. This is a really great episode to share with your husband, your partner, your birthing partner, whoever it is, so that they can also know what signs to look for pre-labor, prodromal labor, early labor, all the things, but also be able to support you during that prodromal labor so that you're not doing it alone or just waiting for actual quote unquote actual labor to start. If you have any stories about your pre-labor, your prodromal labor that you've got to share, please DM me, please leave a comment, share a review, subscribe, like, whatever feels good to you. I'm Dr. Emily, and you've been listening to the Popped Podcast.